Hi, I'm Dr. Mary Bourke and I'm a chiropractor and you're here in my clinic in Newcastle. We're going to talk today about the Myo Munchee and how I use it in my practice and how it's of great benefit to children, your children. And today I'm going to talk to you about the Myo Munchee and how and why it could be helpful for you and your child. Some of the reasons people will be looking up how the Myo Munchee could help would be things like ear infection. They might be looking at poor speech development. They might notice that there's a problem with their child dribbling a lot and that maybe they've spotted that their children's teeth don't come together in the front and maybe they've had a history of thumb sucking and dummy sucking or a finger involved in their child sucking on. This is affecting the way their child's oral facial development is occurring. So the Myo Munchee is a great little tool that can help you get orofacial development back on track. This is what the Myo Munchee looks like for a child, for example, from the age of, say, 18 months through to about 5 years. We have a slightly bigger one for the older children once they get to about 4 or 5, and certainly at 6 they will use a slightly bigger one. But at the age of 18 months to 2 years, a child can start to chew one of these little Myo Munchees, a bit like a chewing brush, that will help to re-educate and get their teeth and their jaws growing strong again. By the age of 2, they have their top teeth and they have their bottom teeth, and we can see how their teeth are closing together. If you find that your child's teeth aren't closing together at the front, this is what we call an open bite. So their tongue might be thrusting through the middle and they may have a little bit of a lisp when they speak, and it's kind of cute at this age. But what that'll be happening is that'll be preventing them from making more articulate sounds with their tongue, but it'll also be preventing them from developing good, strong teeth and jaw development. What the Myo Munchee will do, it'll help exercise and strengthen the jaw and get it back on track. So for children who've been sucking a dummy, the dummy will have come in between the two jaws and will have created a bit of a gap where they've had, and the teeth will have gone around that. And you can see that by the tongue coming through quite often. What the Myo Munchee will do is it'll help get the teeth and the jaws growing back in their normal spot again and help to correct a lot of that. What we're finding now with children is that most food they're chewing is soft. There's no real exercise involved in chewing anymore. So these children are getting weak and underdeveloped around the jaw and facial area. So the Myo is a great little tool for exercising and developing jaw strength so that they can have a good, strong, well-developed bite. And ultimately, what that can mean for you as parents is that hopefully they'll avoid braces down the track. A lot of our teenagers are ending up in braces, and a lot of this problem is because they have poor oral function. And this is evident, poor oral function is evident in children from a very young age, and we can do a lot to help correct those problems if we chew a Myo from the ages of 2 to about 5. Some of the other ways it'll be obvious that there's a problem with your child's orofacial development might be things like dribbling, and another one is ear infections. So if we think about our ideal jaw posture and how everything should function, the lips should be together at rest and the teeth should be sitting together at rest with the tongue sitting on the roof of the mouth and nose breathing. That is how it should work. When we have a child who has an open mouth posture and an open jaw posture with the tongue thrusting forward each time they swallow, we don't have good lip seal and we don't have nose breathing. One of the complications of that longer term can be ear infections. So this is when we see children developing chronic ear infections from the age of 12 to 18 months through to about 3 years, and they get grommets put in. Basically what's happened for that child is they haven't developed good strength through these posterior swallow muscles at the back of the throat. What happens with a normal swallow when our tongue is in the ideal posture is that our tongue sits up on the roof of the mouth, and as we swallow, these muscles at the back of the throat pull on the eustachian tubes, the little tubes that drain the ears, and allow aeration, air through the tubes, and keeps the ear tubes clear. What's happening for these children who have this reverse suck swallow where their tongue is protruding forward, when they swallow, they're only using the forward part of the tongue. They're not using the parts at the back. So they're not getting that pulling on the eustachian tubes, they're not getting that opening and draining of the eustachian tubes. Over time, this can cause them to be more prone to infection in the ear because they're not getting the drainage. These same children are probably more likely to be getting upper respiratory issues because this whole area, adenoids, tonsils, is not well drained. They don't have good respiratory drainage. So that's something to keep in mind too. So if your child's mouth breathing, and you can see that, and they're more likely to be blocked up than not, then a myo can be a very, very helpful way of getting that system working again and getting their normal drainage patterns back on track. Dribbling, children who dribble and have poor tongue function, that same suck, swallow, reverse swallow, the tongue's coming forward, there's poor lip seal, so the dribble, the saliva is coming forward out of the mouth rather than being swallowed. When they have the suck, swallow that works effectively and efficiently, the tongue up on the roof of the mouth, the saliva goes back down the throat and is swallowed. That's the way it should work. So if you're seeing that with your 2-year-old, there's a lot of saliva being produced and it's coming out of the mouth, then the myo can be incredibly helpful for getting back the strength of the orbicularis oris muscle, the muscle that holds the lips together. So chewing a myo, very, very helpful for the children who are dribbling or are having articulation issues. And you can just see that they haven't got good motor control around that oral area. So some of the telltale signs that your child has got a weakness in the orofacial development area would be things like the mouth posture. Does your child at rest have their mouth open? When they're playing, are they having their mouth open? Because sometimes when you actively look at a child, they do actively breathe through the nose, but then when you find they're playing, their jaw's dropping open. Are they breathing through their mouth at night? When they're asleep, can you hear them snoring? Or can you see that they're breathing through their mouth? They should be breathing through their nose at night, overnight, to get good oxygenation of the brain. If you have a child who wakes up grumpy or doesn't sleep well, thrashes around all night, unhappy, we should wake up bright and well rested. If your child's not, chances are they're not getting good oxygenation overnight, not getting good oxygen to their brain. So sometimes that can be happening because they're breathing through their mouth. So these are one of the things you can look at and observe in your child. Are they breathing through their nose? A lot of the time with mouth breathing, it is because the mouth, the muscles that surround the mouth aren't strong enough to hold the lips together, especially in a young aged child. The strength of the oral facial area was traditionally developed through the action of chewing. Well, it started with breastfeeding actually. It goes right back to the very early practices of breastfeeding, and then as the child is weaned off the breast, that they then are weaned onto hard, tough foods that actually require effort. This activates a lot of the neurology, the brain messaging to the lower part of the face for development. So when we are spoon feeding our child purees and giving them a lot of soft food, we're actually not helping their brain to help develop that jaw as well as it should be. So sometimes this has been the practice that has been what we've been led to be feeling is the right thing to do. Jars of baby food or pureeing pumpkin and sweet potato, all the things pureed for the first 6 months of the child's life. I know that's what I did when I first had my children feeding, when that was 17, 18 years ago. I now know I would do it very differently. As their first foods, we need to start looking at things that are going to challenge the jaw and start to some effort involved. And this is where the Myo Munchee is incredibly helpful. So from the age of about 18 months to 2 years, you can start your child chewing a myo, and this can help them reactivate some of those muscle groups that haven't been exercised and haven't been used before now. So the whole idea of getting them to chew hard food is something they're not used to and they probably won't be keen on. So if we can get them chewing a myo and exercise those muscles and the bones of the jaw, get the jaw working well again, and then introduce some of these strong foods to keep exercise happening on a daily basis. This will help them to develop good structure, and the muscles and the bones will grow strong and the lips will seal together. So then they'll hold together, they'll have the strength, the natural strength to be held together overnight. So the nose, which is the mechanism for breathing that we were born to use. And when the nose is being used more effectively, the brain is getting the oxygen it's required, the body is developing well, and we're not getting the over breathing that we will tend to get with mouth breathing and the other complications that come with that. The Myo Munchee, that's all it is. What does the child do? They pick it up, they pop it in their mouth and they chew. They look at the Myo, has the little lips at the top. The child picks it up, has a look, goes in this way, pops it in, closes their lips over the top, holds onto the little handle for the little people and chews. When they get a little bit older, you can cut that handle off and they can get the lips totally together and then they can just chew with it in their mouth. The handle is very precisely for the little ones, 2 to 3 year olds who you want a little bit more control with them so you can help them to get it in. But they're very capable of doing it themselves. By about 4 years of age, they'll very happily pop that in and chew that. And all they've got to do is chew it with the lips together 5 to 10 minutes a day. Amazingly powerful little tool that will help get their oral facial development back on track. And it's not just about having the beautiful face they were meant to have, it's about their overall health and well-being.
Well, I use it in the bath, I use it when I'm watching TV, I use it when I'm reading a book, I use it when I'm cuddling the dog, and yeah.
I know a song about a runaway Myo.
Feels like this gigantic squishy thing, like a big jellyfish is in your mouth.
It helps my teeth.
How do you know it helps your teeth?
Because Mum told me.